Well, hello everybody and welcome to our podcast series, Difficult Conversations with me, Poppy Gerrard-Abbott. Today we're going to be discussing feminist approaches to the coronavirus pandemic. And I am very lucky to be joined by two good friends and colleagues, Lisa Howard, who is a PhD sociology researcher at the University of Edinburgh, looking at climate activism and the home, and Anna Clover, PhD researcher at the University of Glasgow, looking at gender and home-based entrepreneurial work. So hello and welcome.
Hi.
Hello.
Thank you for being a part of this podcast series. So would you mind just talking for a few seconds about your research, just to let the listeners know a bit more about you?
Yeah, sure. Lisa, do you want to go first?
Okay, you go first.
Or I can go first, I don't mind. Okay, so my research is primarily interested in the changing nature of work, specifically in the UK. So my research has been looking at the online platform Etsy and the sort of gender dimensions of work in terms of moving from sort of more traditional workplaces to home-based work, and some of the impacts that is having on the women that are involved in this kind of work, particularly in terms of it being involved in this sort of like new forms of digital labour, digital culture. So yeah, that's kind of it.
Great. Thank you. I'm researching the gender dimensions of climate change impacts on parental activists. So in the UK, there's been a rise in the last couple of years, particularly after the IPCC 2018 report, which warned of only like 11 years to avert the worst effects of climate change. There's been a rise in parental activist groups that are invoking sort of parental narratives and rhetorics to try and have a better influence on government to mitigate carbon emissions. There's been a lot of research on social movements and climate activism in the sort of social movement literature, but not particularly on personal life dimensions of that. And I'm looking at the emotion work, drawing on the work of Arlie Hochschild, her concept of emotion management. So I'm going to be investigating in what way and why there is a gender difference in emotional involvement, emotion management in the lives of parents acting to mitigate climate change. And to determine how these different degrees of emotional involvement and management impact parents' capacity for action in their climate advocacy and campaigning.
That sounds like it's going to be really, really good.
So I'm going to begin by reading some snippets from an amazing article by Helen Lewis, written for The Atlantic. It was published on the 19th of March, called "The Coronavirus is a Disaster for Feminism." And she says, enough already. When people try to be cheerful about social distancing and working from the home, noting that William Shakespeare and Isaac Newton did some of their best work while England was ravaged by the plague, there is an obvious response. Neither of them had childcare responsibilities. For those with caring responsibilities, an infectious disease outbreak is unlikely to give them time to write King Lear or develop a theory of optics. A pandemic magnifies all existing inequalities. But one of the most striking effects of the coronavirus will be to send many couples back to the 1950s. Purely as a physical illness, the coronavirus appears to affect women less severely. We are not just living through a public health crisis, but an economic one. As much of normal life is suspended for 3 months or more, job losses are inevitable. At the same time, school closures and household isolation are moving the work of caring for children from the paid economy, nurseries, schools, babysitters, to the unpaid one. What do pandemic patients need? Looking after. What do self-isolating older people need? Looking after. What do children kept home from school need? Looking after. All of this looking after, this unpaid caring labour, will fall more heavily on women because of the existing structures of the workforce. Despite the mass entry of women into the workforce during the 20th century, the phenomenon of the second shift still exists. Across the world, women, including those with jobs, do more housework and have less leisure time than their male partners. Even memes about panic buying acknowledge that household tasks such as food shopping, are primarily shouldered by women. The most striking statistic from Sierra Leone, one of the countries most affected by Ebola, which was in between 2013 to 2016, during the outbreak, was that more women died of obstetric complications than the infectious disease itself. But these deaths, like the unnoticed caring labour on which the modern economy runs, attract less attention than the immediate problems generated by an epidemic. These deaths are taken for granted. In her book, Invisible Women, Caroline Criado-Perez notes that 29 million papers were published in more than 15,000 peer-reviewed titles around the time of the Zika and Ebola epidemics, but less than 1% explored the gender dynamics of the outbreaks. The coronavirus crisis will be global and long-lasting, economic as well as medical. However, it also offers an opportunity. This could be the first outbreak where gender and sex differences are recorded and taken into account by researchers and policymakers. For too long, politicians have assumed that childcare and elderly care can be soaked up by private citizens, mostly women, effectively providing a huge subsidy to the paid economy. This pandemic should remind us of the true scale of that distortion. So, Lisa and Anna, why do you think that COVID-19 is a feminist issue? So let's list some reasons. So there's unpaid work and the lower paid and less valued work that women undertake. You know, as we're entering this period of lockdown, we're speaking to you from the first day of that lockdown. Why should we start framing this as a feminist issue?
Well, I think as this article lays out, there are a variety of reasons to think about this in terms of it being a feminist issue. I think one of the core aspects of this article is that it refers to how the coronavirus is really sort of magnifying pre-existing issues of inequality. And I think one of the biggest ones, obviously, being the undervalued forms of care work, and I would also say emotional labour, to bring it back to Hochschild again, which is occurring in this situation. And I don't know, there seems to be such a sort of conflicted view about the value of this work that women are doing, because there's obviously women on the front line, and there's so many women who are working in the healthcare providing services. And it's sort of this expectation that they will be continuing to do that. But then sort of more largely culturally, that kind of work is very devalued that women do, and it's very unseen as well. Just sort of like ties into these assumptions about what it is to be a woman, like that it's an extension of your femininity, that you will just take on this sort of, unrecognized forms of extra labor.
No, I'd absolutely echo everything you said. And I'd add as well that, of course, thinking about intersectionality, that the sort of caring work that's being done. So if you think about like the NHS, obviously many more nurses are female than male. There's a high proportion of caring sector jobs that have a racialized aspect to them, as well as gender. And class. I mean, one of the things that I was thinking about with the whole working from home thing is that, the sort of people that are in privileged positions, privileged jobs to work from home tend to be in middle class jobs, and more working class jobs perhaps on the front line of caring professions or working in, the NHS. So, there's definitely, and none of this really gets talked about in the kind of news coverage, and how we just tend to universalize everybody.
Yeah, I think that's a really good point, is that there is a lack of discussion of the very specific experiences which are, originating from, as you say, experiences of class, as well as gender, race, which are putting certain people in very vulnerable positions. I mean, obviously there's the healthcare workers, but there's also the service workers as well. The people that are going back are still working, are people that are working in shops. And, my partner's mother is in her 60s and she works in a supermarket. And it's, that feels very unrecognized, I think. I mean, it's one of the reasons this is so important to talk about.
Another burden of care is looking after people in the community. Women are more likely to help people in their local community. So a lot of what you're seeing are women and men, I guess, but it seems to be women at the moment, starting up these initiatives, popping flyers through through letterboxes. We can help you with your shopping, or whatever. And it's just a sort of that subjectivity of care, of a sense of responsibilisation to help people, which is definitely has a gendered characteristic. And it's kind of, there's literature out there about relational activism. So one of the things that with activists, activism doesn't have to be like a high profile direct action, go out there in confrontational settings. It can also be activism in the community and mobilising people collectively to help, like on a localised scale, is just as important. But of course, it's very undervalued and covered in any kind of media of activism. But it's women that are doing most of this. It's like it's using the private sphere in a public way, extending those ethics of care into non-kin, beyond family, into sort of community.
Yeah, which I mean, that's been an ongoing sort of political position that our government has been taking for a long time now. It's that very a neoliberal attitude of sort of moving the responsibility onto individuals, but of course what that means that it then plays into pre-existing structures of power relating to gender. So the other thing that I was thinking about as well is in terms of thinking about the home, and how the home is not a neutral space for women, and never has been, and the sort of the vulnerability that's put in place there with enforcing women to be in their home. There's so much forms of domestic violence or emotional abuse that happens in the home that we're not even aware of. Because it's so veiled from view. And, my concern is that, what about these situations with women who are not in safe places, they're not in secure homes? And also just to bring it back to class, I mean, if you have a lovely, 3-floor house, but that's a very different experience to if you're in Mary Hill and you're in like a small council flat. And I do feel like, as this article says, this kind of like very punitive attitudes towards like Karens and Susans is really not taking into consideration, like, okay, maybe these people, their kids are out on the street, but that maybe it's incredibly difficult to keep them in a really, a small environment. So I know it's really frustrating, and I've been frustrated with like seeing people not necessarily like following guidelines, but I think those guidelines like are fulfilling, as you were talking about, I think this sort of like universalizing of people's experiences. And so like, of course, everyone can stay inside. Well, it's like, well, there's a variety of reasons why that might be very, very difficult.
Exactly. And I think you're right. I mean, I think so. One of the things that we've had drummed into us over decades is this individualization of we're responsible for our workplace ambitions, our health, and consumerism and everything. And suddenly, we're expected to turn that on its head and not act in a self-interested way. But it's not quite so black and white. I mean, people aren't necessarily selfish if they've just been it's been drummed into them, act in your own interests, and then suddenly, oh no, that's not okay. And I think that as well, that behaviour is complex and it's relational, and so a lot of what we do, as you said, isn't just about our own individual decision making. We have to be thinking about other people, and sometimes what we see going on is not as it seems. There's responsibilities that are not with that person, or background issues that aren't quite so clear.
Yeah, and I mean, I've been trying to make sure that I'm being reflective of that, rather than sort of trying to feed into, these very individualizing narratives about the sort of like, bad people, and like the article says, specifically bad women as well. And I think that's...
Yeah, the ones carrying the toilet roll.
Right, exactly. And I think you make a good point as well, talking about how there's this expectation of really rapid cultural change when we live in one of the most neoliberal economies in the world. this expectation that, suddenly we will be viewing things in terms of community or I don't know, just a consideration of other people when our lives have been directed towards living in a very individualistic manner. And I mean, I think the other aspect to that as well is, I'm just thinking about Angela McRobbie and when she's her work on post-feminism as well, and how that ties to this, or a lot of the neoliberal ideology, which really sort of says that, feminism is over, like we've sorted out all of those problems. And that's sort of like contributing to this probably obscuring of thinking about gender as, an important thing that's happening at the moment.
Well, one of the things with, of course, feminists, like any enduring inequalities, that quite often the people that are the oppressed group are helping to reproduce it inadvertently. So, just in our everyday doing of gender, those interactions, we're just sort of helping to reproduce it. And of course, if women are taking up the mantle of helping people in the local, elderly people in the local community, thereby sort of, disavowing perhaps more men to take up this sort of task, then, it's women, they like doing that, they're natural at doing that, it's just what they're good at. But yeah, it's not to say that women should stop, of course, that's not what I'm saying.
No, I mean, I think you're getting to that, one of the heart of the issues when it comes, I mean, the heart being, the word in this, is that emotional labour, often it involves love and it involves, caring for people. And that is what makes it so complex, is because, we do want to do those things. We do want to take care of people. We do, we do want to enact love towards people. And I think that's part of why it becomes complicated to understand it as a form of labour, and sort of partly obscures why it is a form of labour as well.
Yeah, that's a really good point, isn't it? That love thing, and it's just sort of seen as something that's innate and natural, but actually the kind of doing love is work. Often it involves self-sacrifice and compromise and all these things that are kind of undervalued.
Yeah, and are seen as being very essentially feminine qualities as well. Being selfless and prioritizing other people above yourself. I mean, also I've been thinking about in terms of emotional labor, the sort of the care work that goes on in terms of taking care of other people's emotional well-being as well. And I'm just thinking about my mum and the amount of sort of emotional work that she's been doing, with the family, and just like, making sure everyone is okay in terms of their emotional well-being. And, I think that's such I imagine is going to continue being such a big part of this, because, women do tend to take on that responsibility for the people in their life, and a lot of the times the men in their life as well. So
yeah, absolutely. And it is something that's going to be a big part in the kind of rebuilding after all this mess, because obviously there's a big consciousness these days of mental health issues, and it has been talked about people being confined indoors and loneliness and isolation and stuff, but there needs to be recognition as well of, like you say, this emotional labour that's already going on and that's actually helping to mitigate these effects.
Yeah, absolutely.
So we're going to have to move on to the next question. But just before we do, I would also like to add to that two things. So the first is women's rights. So there's currently a consultation going on that will close today around how reproductive rights and abortion access are going to be added to the coronavirus bill, because they're basically absent. So this pandemic is going to worsen and seriously implicate the access to services and provisions that women already struggle to access. So, for example, domestic violence shelters, support for rape, abortion. These are already complicated and incredibly difficult and laborious processes to access, these things which are actually women's rights, and are going to be further delayed and complicated by the virus. And secondly, something that I've noticed is this stark image around representation. So when I'm watching the Prime Minister's announcements in the evening, his daily press conferences, I think it's really stark how the people making the decisions are largely men, and the people carrying out the work of these decisions are largely women. If you look at who is at the podium and who is involved with making these significant national policy decisions, they're all men. I think I've seen one woman at the podium at press conferences, and 90% of nurses are women. So that's just a really interesting image that I've noticed. So moving on to how is COVID-19 sexist, although we've answered that in many ways, I just want to speak a little bit about how sexism hurts women. So we know that sexism is happening and is being amplified by the virus, but what impact is that having on women? So when I ask that question, what comes to mind is the mental load and how that will be increased by the virus. So you're suddenly having to worry about whether there's going to be any food in the shops, what you're going to do if Nana dies tomorrow, what you're going to do to keep the children entertained, where you're going to find time to put on makeup before your Zoom call. And I think another aspect, bringing it back to the emotional, that really hurts when it comes to the sexism of the pandemic is this assumption that women will just pick up the pieces. How do you think the coronavirus is sexist, and what impact does that have on women on an emotional level?
So I think that it's sexist if we look at the sort of economically in terms of work. So the retail and tourism sectors are predominantly female in staff. And I think that obviously those sectors are going to be hit really hard by the economic impact. So there's going to be many, many job losses in those sectors. And I think then, that is particularly damaging if you've got, say, like a single parent family. You've got a single mother, perhaps as raising children and then dealing with job loss. Of course, there will be across sectors job losses, but from what we see right now, there are many sectors that are going to be, the knowledge-based sectors are going to be quite protected. Financial services are going to be protected. In fact, the government, as they did in the financial crisis, are making steps to, behind the scenes, protect the banks and, fiscal measures to protect the financial services sector. So I think that if we look at job losses and the fallout from that, economic, emotional, practical, dealing with, the issues of, trying to find another job, etc. So I think that's one thing. I think then as well, we've talked about the burden of care. I think just like if we think about mobility regimes, so it's as a geographical concept and mobility regimes. So if we think about the fact that we've had these self-isolation rules imposed on us, and we talked about the confinement of people in the home, but if we think about how people actually do still need to get about and go to the shops, and so this mobility regime of don't go out privileges car owners over public transport users. So you've got issues of, if you think about intersectionality, issues of class and race in who uses public transport more and who's more exposed to the virus when they do use public transport. So, it's quite interesting there how it doesn't seem to be any kind of imposition on driving around. People just assume that if you're out driving your car, you're going to the shops, to the supermarket, but that's not necessarily the case. So I think that, for those people that are reliant on public transport, it's still running, but of course it's, are they going to get shamed if they're using it? It's, the media seems to love shaming people at the moment.
And the stress levels that women in roles such as supermarket workers will also experience as a result of everybody projecting their stress onto people in such roles. So that's something that's also jumped to my mind as well. How will nurses and women in roles like cashiers not only be
definitely
in the heart of the pandemic and at higher risk of contracting and being exposed, but also how they will be absorbing and navigating everybody else's stress.
Yeah, well, I've got a few things that I've been thinking about. I mean, for one thing, thinking about the intersectional impacts of the coronavirus. We've spoken about class and a little bit about ethnicity. I also think disability is something that is really important to be aware of at this time. I think, the government sort of rhetoric of essentially being like, well, it's only going to affect people with pre-existing medical conditions is really shocking and disgusting, as though those people somehow, like, it's fine if they die from the virus. I think disability is something that generally gets forgotten a lot in conversations about sort of intersectionality. I have a good friend, Ida, who's always like reminding me how important that is as part of this. So yeah, I mean, the other aspects that I've been thinking about is in terms of I think the punitive aspect of sort of, as Lisa was saying, about the sort of laying blame on people. I think one of the things that I'm concerned about as well is one of the sort of like most insidious aspects of neoliberalism is that it makes everybody feel as though the problems that they're having are essentially like about them or are very individualized, and it can really obscure sort of like structural issues from view. So, and then adding on top of that, this experience of isolation, my worry is that people are going to be, and women in particular, are going to be suffering, and then sort of maybe placing the blame because they're not dealing with the coronavirus in the right way, or, setting. There's this also this piece that I was reading recently I love Angela McRobbie, and she's been writing about perfectionism as a sort of like a disciplining force for women, that you constantly have to hold yourself up to a certain form of perfection. And I could really see this potentially playing out on the sort of coronavirus thing of like doing the coronavirus in the right way. And that doesn't just mean like, not going outside and having the boundaries of other people. It's also like, making sure, like you were saying, Poppy, like, your weight is still the correct weight, and like that you're grooming yourself, or, that you're keeping on top of your work, that your children are, healthy and happy and everything else. And like just this sort of general expectation of the really sort of ridiculously high expectations that we have of women generally.
I just wanted to add that I think the nation's performance in terms of its adherence to the policies that the UK government are administering will fundamentally rely on the expectation for women to juggle all of the asks that are being put to them. So keep your children inside, make sure they're staying educated, make sure everybody's eating healthy food, make sure everybody's exercising, make sure that you keep the house clean so that the virus doesn't spread. These are all within the umbrella and the jurisdiction of women's labour.
Yeah, absolutely.
So moving on, how can we look at the economics and politics surrounding coronavirus from a feminist angle?
So I've got something to say about capitalism, about the economics of this. So obviously we rely on capitalism and capitalist accumulation for our economic model. And I think that one of the things that capitalism, as we know, Marxist thinking, that it undermines its social and environmental base on which it depends. And I think that the false binary of nature and culture has been very much brought to light here. So the kind of privileging of the anthropocentric view of the planet Earth and how the domination over nature, this has proven once again that we are as fragile as any other living being, and that it's very much tied up with globalization and capitalism, that the circulation of this disease is completely entangled with capitalism, because the very way it's moved around by obviously people travelling has been, part of the way we operate with flights and cruises and then the tourism sector, etc. So it's really interesting thinking about that, and also how the kind of reliance on consumerism, which is not particularly a feminist issue, but it is obviously tied to capitalism. Well, it is indirectly linked to feminism. That we are seeing, these very dire prospects for our economy really kind of buckling under this, because the bottom's fallen out of the whole consumerist machine. So I just think that it shines a light on kind of radical alternative ways to live. How should we live that isn't based on stuff and buying stuff and traveling and just this endless quest for more. Sorry, that was a ramble.
No, it wasn't at all. I think making a critique of capitalism is a really essential part of this conversation. Obviously, if we, as you're saying, thinking about, the Marxist critique of capitalism is that it is fundamentally exploitative. And I would also, say, thinking about Marxist feminist writers as well, that the capitalist system has always been dependent on the unpaid labor of women. That has always been how it has been able to reproduce itself. It's through, women taking on the work in the home, the reproductive labor within the home. So, I think that is, that's a really essential thing to think about. And also, as you're talking about how our economy has moved into being a service-orientated post-Fordist economy, this is very reliant on the labour of women. And one of the reasons for that is because women have been seen as being cheap labour. So, that's part of the proliferation of there being so many women in those sorts of roles. So, absolutely, I think there is a link that we can think about in terms of consumerism and the experiences of women, because so many women are employed in those service sector positions. And I completely agree. We don't know what's going to happen, but I really hope there is some level of reflection about fucking capitalism.
We've spoken before, Lisa, about how the pandemic is shining a light on a particular kind of hegemonic, aggressive hypermasculinity that has shaped our economic order and has also shaped our relationship with the environment and with nature, that it needs to be something that is groomed and controlled and invaded and manipulated. And I think there are arguments to be made that this hegemonic form of masculinity has contributed to pandemics that relate to viruses coming from exotic species and coming out from areas of nature where we have invaded too much.
Yeah, absolutely. I read an article actually the other day, I think it was in The Guardian, that they think that the degradation of habitats has fueled the species jumping of this virus. I mean, it's not the first time that diseases jump the species gap. Of course, the plague came from rats, but it's facilitated when there is stress in the ecological environment because you've taken away so much of its land and it's the habitat, and then animals that would once have been healthy and being able to live in a natural way, and now having to they're stressed, and the diseases that are being kind of created in their populations are jumping across to ours. So it's definitely to do with environmental destruction.
And that just goes to show how climate justice is fundamentally interlinked with feminism. So adding on to what we've already discussed thus far, how can we look at this intersectionally? So we've talked about single mums and the able-bodied and disability elements to the coronavirus. I'm interested in how a socialist programme, which has been rolled out by the UK government at the moment, you know, with more benefits and subsidies to wages and so on, this has happened because the rich and the able-bodied have been affected by the virus. And so how else do you think we can think about this intersectionally? So we've figured that the virus is not just sexist, but it's also ableist and ageist and racist. Do you have anything else to say about that?
I think you said it perfectly, Poppy.
Yeah, I think so too.
Okay, so my final question to you is, if you could say one thing to policymakers at the moment to ensure that women's voices are heard better in decisions and legislation and policies made around the coronavirus, what would that be? For me, that would be making sure that they're making long-term economic plans, so not just ring-fenced within the coronavirus, but they're seriously reconsidering the ways that the benefit system runs and the ways that single parents are viewed and the ways that unpaid labour continues to be just relied upon whenever there is a crisis.
Yeah, I think I'd also add that kind of it's so there's obviously this notion of scientific imperialism. You know, so much of this is being led by the science, which, you know, okay, yes, of course, we need to have these clinical epidemiologists, I can't say that, modelling how disease spreads through populations and thereby shaping policy to, you know, enforce lockdowns and such. And I think that at that level, I'd be interested to know how much is considered in the kind of contextual risk factors that relate to social structure of, you know, gender and race and able-bodiedness. I think that by modelling based on perhaps the ideological white male, obviously population is extraordinarily diverse, and of course, if government is listening to scientists, modellers about how disease spreads, and the lockdowns are then going to impact people disproportionately, as we've just discussed at length, then I think, you know, there's a question to be asked there about what are the assumptions that these models have within them about disease spreading. Now, of course, you have to take the precautionary principle and guard against risks of any transmission, but you know, you could argue, well, why wasn't this all these measures put in place sooner? That's been one of the critiques, hasn't it, of our government, that other governments were much quicker to respond in strict enforcements of movement. So yeah, I think I'd be interested to know, and it will probably come to light over the coming months and years when it gets researched by you know, academics. What are the kind of the sort of gendered aspects of those scientific voices and the advice that is being drawn upon?
Yeah, I think that's such a good point, because as you're saying, within the sciences, there does tend to be this universalizing outwards from the white male, and then as you say, the advice that comes from that. I would also say, like, as you were mentioning, the ways, the methods of measurement that are being used. I'm a qualitative researcher, so I have my own views about that. But, you know, there is links to that neoliberal ideology, again, of seeing everything in a way where it can be quantified. So, you know, there's also a concern about the kind of data that's being collected and how much of a sort of full view it can really provide. We do need to have that qualitative data as well.
Let's hope that a feminist, more socialist economic situation comes out of the coronavirus. Let's all wish for learnings to come out of this crisis. Thank you so much for joining me.
Oh, thank you.
Thank you so much for having us. Really
Anna, it was lovely meeting you.
Yeah, you too, Lisa. And I'd love to actually meet you in real life.
I know. Once all this madness is over, we'll get together.
Yeah.